Thank you very much, Milton. Milton's my Asian brother. We have different mothers and different fathers, but we've formed quite a connection over the last almost 5 years. So I now call myself an old timer in this industry. I feel like I've been around, but I also feel like I'm the Rachel Ray of telehealth. I really do. Rachel Ray, you guys know, she wasn't a chef. She has her own pots. She has her own cookware. She's got television shows. I mean, she's everywhere. But I'm not a physician, so I'm a rare bird. I also have a confession today. Okay. I flew in from South Florida right after Miss Irma hit, so I'm a patient today. I've been a patient for the last couple days because South Florida, as well as Texas, as you all may know, is littered with allergens right now. And when you have a hurricane the size of a state hit for the first time in history, we've got millions and millions of people today, and over the last, will probably last for quite some time, with allergy issues. Now I want to ask you, is there a doctor in the house? Well, the second question, which is probably more important, how many of the doctors that are in the house today want all of those millions of patients in your waiting room, clogging up the waiting room time for those allergy issues? Do you want that natural disaster that caused that simple crisis to reflect in your scheduling, or do we want to deploy a different way of addressing that type of a healthcare need? We're talking millions. It's millions now when you looked at it. When I arrived back to the state, my husband stayed with a hospital that he's associated with and stayed with the patients and things like that. I got out of there. I did a meeting up north. And so when I came back, I thought everything would be fine, but it wasn't. There was no power still. So I came back to no power, littering, everything was just destroyed and looked so different from the air when we were flying back in. But those are some of the reasons why we look at telehealth differently. And whether we've been addressing all these wonderful speakers, I'm humbled. I'm so humbled to be here addressing you today because I'm going to share my very personal journey with you. And I think that it might resonate well because it's more of a beginning journey, even though I've been doing this now for almost 5 years. So let's see, where's my pink socks gentleman? He was down here a minute ago. I don't have pink socks. I'm very sorry about that. And if you were here yesterday, we had some pink socks. I wish I had lots of pink socks. I like pink. But I do have a lot of pearls on today. So I could give you each a pearl, right? Or I could just give you some pearls of wisdom. And let me just tell you, I've seen it all. I've seen it all. I've worked with some of the most amazing people over my career. So I'm just going to tell you, how did I get into this? I wasn't a physician. You're all sitting there. There's a lot of physicians in this room, and we rely on you for our telehealth needs. But my journey started in 1984. I know, I don't look that old, right? Hopefully, thank you, thank you. I started off I wound up being a medical secretary of all things. And like, how do you get from being a medical secretary in 1984 to owning a multi-million-dollar company in telehealth in 2017? How does that happen? That's crazy. I was actually going to be an opera singer, but I'm not going to sing for you guys today. I only sing for Milton and the team. So after a while, after I saw a diabetic treatment center on the floor. How many days was somebody an inpatient at a diabetic treatment center in 1984? 5 days? 4 days? 3 days? No days? 3 days. They were an inpatient for 3 days, new diabetics, pediatric and adult. I actually worked on that unit. It was fun. So it helped me now in the telehealth world to imagine how can I virtualize these things that used to take 3 days as an inpatient and make it more impactful through telemedicine. So that got my mind thinking as part of my journey. I then worked for Dr. Elia. Dr. Elia was family practice, and guess what? He needed a medical coder. So I learned medical coding, pretty important when you start looking at how the pieces of the puzzle fit together in telehealth. You can't just have one specialty. You have to rely on a lot of vast knowledge and a lot of experts and great co-founders. Please pick great co-founders. It's so key. Then I went and I said, okay, I want to go into child life, family life specialty. So I went to a teaching hospital. Wanted to do some more with teaching the patient interactions on what that procedure was that they were going to go through. What does that diagnosis really mean? And have a heart-to-heart with the family. What's going to happen after you leave? So that brought another light to my plate full of spinning plates that I've had in my career. Then I went out to the community health side, and I started working with what now is one of the Northwestern hospitals up in Chicago. It was acquired recently, and I started working with all of these suburbs in Chicago and building teams that were really deployed out into the communities. We leveraged park districts, we leveraged social services, and we had mass population events. And those were really a key thing back then of keeping our communities healthy and educated and really pulled together as a community. Very important stuff. Well, gosh, then corporate America called, excuse me, corporate America called, and I worked for a corporate health corporation for about 15 years, actually, which was really fun. I had clients like HP, and I was pretty excited about that. Gap, just amazing, amazing clients that we got to work with. And then I was part of an acquisition team, and we were acquired by a major carrier. That was when the fun really started, folks, because that was the end of the journey, looking at the payer side, looking at that functionality. You know, when you look at the different sides of healthcare, you really realize it's pretty complicated out there. Most people do not see each of those sides. They don't have that opportunity. So I was quite fortunate. And then when I got over the payer side, I saw, I think 16 states back then had access to really deploy telehealth. And I'm like, this is gonna go rampant. This is gonna be great. So I was like cheerleading to do all these exciting things on that carrier model to pull together different departments. Not gonna happen for many different reasons, a different conference topic. So a bunch of us got together, we met with Milton, we met with a whole bunch of leading experts, and I had a great conversation with one, I hope I can say that, I don't know if they're here today, if MD Live is here today, because they know we're great friends, but I wanted to meet with who was one of the leaders in the space at that point in time. So I met with Chuck. and Chuck tried to talk me out of this. It was crazy. I'm like, wait a second, Chuck, I've got a brilliant idea. You guys are the leader, and I look up to you as icons. No, run the other direction. This is a lot of work. This is going to cost you a lot of money. And I said, Chuck, I'm going to bootstrap this. And he laughed at me. And I should have listened to him. No, I'm kidding. I'm kidding. When Milton asked me to speak, I was so honored. But I said, well, Milton, what do you want me to speak on? I'm going to be up before Microsoft. Are you crazy? I said, do you want me to talk about how to build a telehealth company on a shoestring budget? Because I'm an expert on that, because we did bootstrap it for such a long time. So taking all of that, you learn a lot of life lessons that can be really valuable on telehealth teams. So much so that we said our goal is just to normalize telehealth. Let's all say it together. We want to normalize telehealth to increase adoption. What's wrong with that? It can't be too complex. Complexity is what makes us run the other direction. Complexity is what we have right now. Simplicity, normal is good. But we believe strongly in the continuum of care. So bringing them in from starting kind of like that community program I told you about when I was at the hospital that was just acquired by Northwestern, you know, kind of in that community setting of health and wellness and prevention. And then as the need comes, you start to address other issues. Episodic, chronic care, all of these other great things. We'll talk a little bit about that. But we started with a plan, and our plan, as the Rachel Ray of telehealth, was not too complex. It was actually a giant poster board with a big circle, and I said, here's everybody I want to connect, because I was called the dot connector for years, and it actually worked very, very well for me. We're still connecting dots here at this conference, which is wonderful for you to offer that. So you start with that plan, and you don't try to get too complex with it, or you'll get stuck. You'll get so buried in that plan. So I love one of the speakers yesterday was talking about her 3-year plan. Yes, you have to have that 3-year plan and that goal. And then know the people. We talk a lot about patients, but guess what? There's a lot of people that are not patients until they enter in through telehealth. So they may not be in your Epic. Your Epic records. They may not be there, and you have to prepare for that. You have to have an entrance for somebody that's not in your health system yet as an inpatient or an outpatient. You've got to think about the push and the pull of that data. It's very important. And then you have to partner well. So I can't say enough about our friends here that are hosting this conference. They're a lifeline. They're definitely a lifeline. And then I believe you have to be very persistent, because there will be a lot of people that come to you and you say, you're crazy, you can't do that. And you're like, well, let's try it. Why not? Let's be persistent. And then build a platform or work with somebody who has a platform that you can use and have successful engagement in that particular experience. You know what I liked about what Katie saw? Katie from Fitbit, when she first saw our platform, she said the 2 words, memorable and meaningful. Now, who watches American Idol? Or this, no, it's this, what's the one, Got Talent? America's Got Talent is the one that Simon Cowell's on now. So he always says, like, if there's a really bad singer or maybe like a comedian or something like that, well, I'm not going to remember you in the morning, so, and then buzzes them. So you want to be memorable. You want to be memorable and have meaningful interactions that are going to make a difference in the lives of those patients that you serve. So I believe that we're looking for something new. So we're always looking at customizing and bringing solutions that are new and fresh. Single solutions and flexible partners are key because you don't want to have 10 million logins, 10 million communication plans. Everybody's buried in usernames and passwords, so let's keep this as simple as possible. We also want to be clinically significant, but make it a blend of wellness, healthcare, and technology. It has to be a blend of all 3. So you have to have partners that understand all 3. That's very important. Data. You can't validate without the data. So build that in on the front end. Start talking about that in your sales pitches, because if you don't have that to show for it, you're not going to even get to the end of the conversation. And then customize and communications. Work with communications professionals that can really bring your message to light. Budget friendly. I did a shoestring budget. If I can do what I did, any of you can do it as well, and some of your budgets are much, much more elaborate, I should say. So look at things like SSOs so that we don't even have to think about how to get into our platform, and year-round engagement. It's not about an episodic event. It's not even about that ER diversion and just that ER diversion. Dr. Marilyn Lee is here, one of our doctors, and we were talking at lunch, and I'm like, you know, it'd be great if we could do a lot of gaps in care, and we're starting to work with some carriers on some significant telehealth gaps in care programs. That's very exciting because it doesn't exist yet. I like working on things that don't exist. But it's not just about a gap. We don't live life with just one gap or 2 gaps or this and that. It's really a whole continuum of care, so to have that baseline is so important and valuable. Now, what does the employee need? I actually, when I was here at the conference yesterday, I got an email from one of our PAs that works for us. And she got a message from a member, and I won't, through HIPAA, divulge who this is. The member says, I'm not sure if you can help me with this question, or if you need to direct me to somebody else. I'm considering having a procedure done that will hopefully alleviate my ear tube dysfunction. It is pretty severe, and my ear doctor, Dr. Selman, thinks it will help. It has to be done at the hospital under general anesthesia. He said the hospital would cost about $6,000. I said that would not meet my deductible, so maybe I would have to self-pay. When I called, and this is one of our members. Wait till I tell you about her. When I called the hospital, St. Francis, they said the procedure is not covered by my insurance. I have the cost of $30,000, but with the self-pay, it'd only be $6,000. Do you know who's telling me all this information? What type of member this is? This is a nun. This is a health consumer that's one of our patients. We service a Catholic Medical Trust as one of our clients. And this is a nun. This is how people are thinking. They're getting more and more sophisticated. I think I can manage that, but how much would the anesthesia cost and the doctor bill? These are the types of questions we're getting besides just some of our symptoms that we're trying to take care of with our episodic care or our chronic care. It's exciting because the patient needs a bit of everything. They do need something new and personalized attention. They need convenience. They need device connectivity. They need it all along with that year-round support. So we didn't build a platform that could just do episodic care. We actually started in the employer space because we knew we had a business case for the employer space with a tele-wellness program. And we build in these different points of interest for that continuum of care. So pitfalls, because I've already had some of those, and so you can learn from my experience. Don't build or buy what you personally want. Think out of that box and buy and build what they need. So you really have to know who you're building this for now and in the future. Don't be everything to everyone. You have to have a focus here to get started, or you'll get kind of lost in the track of things. I did not get stuck in the crowdfunding seed stage. I just went ahead and bootstrapped it with a bunch of amazing partners and amazing co-founders, one that's here today. And then don't reinvent the wheel, invent the next innovation in healthcare delivery, is what I say. So we get a lot of feedback. You want to listen to the feedback. But one of the things that we did that I felt was very key is we did do focus groups along the way. So I knew exactly who I was going to sell to. I was actually selling to insurance brokers and employers direct. So I got their opinion. We built with their opinion. It was real helpful to close our first contracts, and now we continue to evolve and move in different directions every day with the support and assistance of a wonderful team, an amazing team internationally through our VSee team here today that I want to thank for that opportunity. So, what are your market differentiators going to be? Where are you going to start? Who are you going to partner with? Is it going to be a fun journey? We had somebody who's a little bit newer that we were talking to today, and she's like, this is so exciting. I'm like, yes, we want to keep that passion alive, so hire well, because you work a long time. I was a little bit hesitant, Milton, and I was talking, I think, to Becky about this, because I don't get out of my VSee box very often. I was like, maybe I could bring a frame that I could just stick up and say hi to everybody. Because in our office, people are all over the country. And so in our office, what we do is we are on VSee 24/7. We're probably the highest users of VSee from an office perspective that exists now today. But I want to thank you for your interest, and I hope this was helpful for you all today.
So Marilyn, thank you so much for that, a lot of tips. Can I just ask, I know you give a lot of tips, it was a general for apply, which is really helpful. Thank you so much for that. Maybe I was thinking maybe you could just give like a 1-minute advertising for Hawa, like just tell them, what do you do, what do you actually sell, what do you... Yeah.
Excellent. Well, HOW is a great partner for employers throughout the country to have a national service presence that starts with a telewellness program. The components of that program are key because we start with a HOW Health Point checkup that includes preventative tests that allow us to see inside the window of that particular member. Most of the time it is incentivized, which really helps with our very high engagement rates, but we need to be creative to keep the member engaged throughout that year-long program. And in many cases, we're on year 4 for our telewellness program. So we've continued to renew those contracts. We also work with that member then to explain their biometrics and labs through those telehealth visits. We gather their goals. It's very important to us right up front to know what they want to work on. They may be a diabetic, or they may we may want them to stop smoking. But if they're worried that they're going to gain weight when they stop smoking, we're not going to get anywhere with that goal. So we're going to meet them where they want to start. They can have consultations with a wide variety of providers throughout the year in that program. And then we do prescriptive health devices. So looking at their goals and looking at the chronic health care conditions that are revealed and some of those preventative labs, we equip them and we empower them, and we're their friend in healthcare for the rest of the year. And when we get questions like this, we go to who we have to go to get those answers for them. So they trust us. There's a huge trust factor, and you can get a lot farther when your members trust you.
Thank you so much. Do you have any questions?
Hi, thank you for the talk. At a previous life, I was doing something where we were selling to large self-funded and self-insured employers, and it's brutal. And just selling to employers, I feel like, is very, very challenging. Long sales cycles, et cetera, and they're getting hit by a lot of different vendors. So I'm really curious. One, were you, or are you constrained to selling to self-insured employers, or can you go to fully funded employers as well? And can you just tell us a little bit about how your sale, obviously within what you're able to disclose, but I'd love to just hear more about sort of what that sales cycle looks like and what you found has been effective for kind of speeding that up.
So in my journey, some of my favorite sales cycles were 3-year cycles because I felt such victory after 3 years. I was like, yes! Of course, there were some of the more profitable ones as well. So I think sometimes you do have to nurture those relationships. It helps to be incredibly well connected. I think Milton keeps wondering how I find people to talk to. But it's just all about connections. We were at a carrier, was it 2 weeks ago? We were at a carrier, can't tell you which one or anything, but literally we sat down at the table. After 2 hours, somebody said we might have a contract in 2 weeks. I was like, what? I was pretty happy about that. But if the need is there, and the need is great enough for that person or that organization that you're meeting with, that cycle can be shortened dramatically. You got to find where their pain point is, and I think that's one of the things that we were identifying. And there's a lot of pain right now, so there's so much opportunity because there's a lot of pain points. And then if you can align with being that solution, you're going to go much farther, much faster. But it still takes those connections and relationships and a lot of hard work and patience.
So first of all, you're amazing. I have 2 questions. Have you ever served as a consultant to startups? And my second question is, how do you retain your patients after they leave the company?
Great, 2 great questions. I talk to startups nonstop. I really try to make a point to help out in any way, shape, or form because I had some great partner relationships, but I didn't have a lot of wonderful mentors. So I put myself out there after I got my legs pretty steady and said, well, I think I can help. And so I am working with a lot of really exciting startups right now. I almost acquired a company, which one of the physicians is here from that particular company that's coming along with us. We're working on an acquisition. So I think there's a lot of opportunity when you're starting to work with startups to get engaged with them in more meaningful relationships as they grow too.
Any other questions? Yeah, thank you so much, Marilyn, for the insight.
Thank you.